Hi, I'm Brian Barrett, and I did my paper on obesity and sugar sweetened beverages. So, sugar sweetened beverages are beverages that contain sugar that is harmful when consumed at high levels. And so, some examples of this are soda, sports drinks, fruit drinks, flavored water, sweetened tea, and ready to drink coffee, all things that you can find at convenience stores and gas stations across America. So, it's important to understand how obesity is measured. And so it's measured by body mass index, also known as BMI. And a BMI of 25 to 30 is classified as overweight, and a BMI of 30 or more is classified as obese. And so below you can see the equation on how it's actually calculated. And so some facts about obesity. So the prevalence of obesity was 39.8% and affected 93.3 million adults in 2016, and that's continued to rise through 2019. A third of American adults are now obese, and that's up from 1/7 that were obese in the 1960s. 1/6 of American children are obese, and that's more than tripled since 1962. Um, Medical cost related to obesity has also risen to 147 billion in 2008, and that's continued to rise substantially over the last decade. So some facts about sugar sweetened beverages. So calorie intake from sugar sweetened beverages has increased from 3.9% to 9.2% between 1978 to 2001. And in some age groups, specifically teenagers and young adults, that consumption has gone up about 500%, which is substantial. So another fact about it is that it blocks leptin signal pathways, and those are essential to regulating energy expenditure, appetite, and metabolism. And because this pathway is blocked, the body is no longer able to regulate intake, and this often leads to a sense of starvation, which drives further food intake, which drives them to eat more, basically. And so sugar sweetened beverages' ability to block leptin receptors poses a major issue for people as they lose their natural ability to regulate their intake. And it often leads people to not understand how they're still hungry after eating a good amount of food. So there are a lot of health issues that are related to sugar sweetened beverages and obesity. And so some of those are risk of coronary disease, hypertension, stroke, type 2 diabetes, and various cancers. And although all of these are serious, type 2 diabetes is a big focus of this policy area because it's taken a grip on the on children, and the rate of childhood diabetes has increased substantially over the past 2 decades. And so that's a major issue that policymakers are attempting to address. And so I focused on a paper called Sugar Sweetened Beverages and Obesity, the Potential Impact of Public Policies. And so this paper focuses a lot on how sugar consumption and sugar policy can relate to tobacco and alcohol policies that have been implemented over the last half century and have been very, very effective in limiting the consumption of alcohol and tobacco. And so it actually includes a quote by Adam Smith discussing how alcohol, tobacco, and sugar are three great targets for taxes because they're basically universally consumed. And so that kind of leads us to our next point on what policy should be used to intervene in this. And so the authors of this recommend a 1 to 2 cent per ounce tax, and so that would raise the price pretty significantly. And it's been proven that higher beverage prices reduce consumption, which is the entire point. And so that could lead to a 10% increase in price, which is well within reach, would reduce consumption by 8%, which would be a very good starting point. This tax would also raise $15 billion, and a 2 cent per ounce tax would raise substantially more. And so that money could be used for things like education programs and other programs that help people not only learn about obesity, but get out of it. And so another important intervention to go along with this would be to subsidize healthier drink options. And so this would basically be to basically blunt the effect that lower class families would feel because wealthy families can already afford to buy healthier drinks, and so this would allow low class families or poor families to afford these healthier options and change their diets And so that would be a great way to even the playing field for everybody, especially the lower class, which is affected disproportionately by obesity. And so, in fact, in Berkeley, they actually did put in a sugar sweetened beverage tax. And so you can see here on the chart that basically consumption of all the different types of sugar sweetened beverages was pretty substantially decreased over the 3 years that it's been implemented. They actually had a 1 cent per ounce tax. And so they compared this to the Oakland and San Francisco areas that are nearby that did not implement a tax. And so you can see there's a pretty substantial difference between the two areas. And the tax definitely made a substantial change. It's also interesting that water consumption increased 29%, which would be a great effect of this policy as well. And so this basically just proves that this policy can be used and generalized over a large population, and that it will still be very effective. That's all I have for you. So thanks.